Dengue hemorrhagic fever. Dengue hemorrhagic fever is a mosquito-borne disease that occurs in tropical and subtropical regions of the world. For mild dengue fever, it will cause a high fever and flu-like symptoms. Meanwhile, for severe dengue fever, it can cause serious bleeding, a sudden drop in blood pressure, shock, and even death. Dengue fever risk factors. You live or travel in the tropics. Being in the tropics and subtropics increases the risk of contracting the virus that causes this disease. If you have had dengue fever in the past, previous infection with the dengue virus can increase your risk of severe symptoms if you get dengue fever again. Causes of dengue fever. This fever is only transmitted through mosquito bites. Two mosquitoes that can transmit this virus are Aedes aegypti and Aedes albopictus. When a mosquito bites a person infected with the dengue virus, the virus enters the mosquito. Then, when an infected mosquito bites another person, the virus enters that person's bloodstream and causes infection.
Dengue fever.
Symptoms. Usually symptoms will appear from 4 to 10 days after you are bitten by a mosquito. High fever up to 40 degrees. Headache. Muscle, bone or joint pain. Nausea and vomiting. Pain behind the eyes, swollen glands. Rash. Most people recover within a week or so. In some cases, the symptoms get worse and can be life-threatening. Dengue fever warning signs: severe stomachache, vomiting constantly, bleeding from the gums or nose, blood in the urine, stool, or vomit, bleeding under the skin, which looks like a bruise, difficult or rapid breathing, fatigue, irritability or restlessness. Diagnosing this disease can be difficult because its signs and symptoms can easily be confused with other diseases, such as chikungunya, Zika virus, malaria, and typhoid fever. Dengue fever prevention. Use air conditioning or mosquito nets installed in the vents and beds. Wear protective clothing when you go to mosquito-infested areas. Wear long sleeves, long pants, socks and shoes. Use insect repellents such as permethrin, as they can be applied to clothing, shoes, camping gear, and mosquito nets. Reducing mosquito habitat by closing standing water. Clean containers filled with water once a week, such as planting containers, animal dishes, and flower vases. Keep the water container closed between cleanings.